welcome to my channel. So today I'm going to go through neonatal resuscitation algorithm. So of course you have to know that everything starts from the antenatal counseling, where from the antenatal counseling about how the baby is and if there is any fetal compromise that we have noticed. Then after that, the equipment check. So you have to make sure even before the baby is born, everything is available. Then also the team should be ready. Okay, then once the baby is born, then you put on the resuscitator, then start the upga clock. And after start the upga clock when the baby is born, so we are now at birth. So you have to dry the baby and stimulate and keep warm. So for babies less than 1.5, you can also wrap in a plastic bag, so that they don't lose a lot of heat. Okay, after you have done that, then you have to come here and assess for color, tone, breathing, and heart rate. Okay, so if the baby is crying or breathing well, then just do a routine care. You have to maintain warmth and ongoing evaluation, so there is no need for the next steps. Okay, but after 30 seconds, or after you have done all this, they are supposed to be done within 30 seconds. Then during the 30 seconds mark, if the baby is gasping or not breathing, we can position in neutral position, where we open airway. Okay, where we open airway, we suction only if visible secretion, so there's no need of suctioning things we are not seeing. Okay, then after that, then you give 5 inflation breath, 2 to 3 seconds on should be room air. Okay, those are inflation breath. Okay, then after the inflation breath, then if the chest is not moving, then you will check the head position, and you also consider airway maneuvers. Okay, then if available, you can also connect a pulse oximeter. Then you have to know that at least the acceptable predictors saturations at 2 minutes we're supposed to at least have it at 60%. Then at 3 minutes at 70%. Then at 5 minutes at 85%. Then at 5 minutes at 85%, then at 10 minutes, that's only when you can see it at 90%. So you shouldn't worry too much when it's you're just starting the resuscitation there, and then want it to be at 99%. No. Okay, so we said when the chest is moving, we assess the color, tone, breathing, and heart rate. Okay, then you said if the chest is not moving and you recheck the head position and you consider airway maneuvers, then you can that's only when you can come here to the ventilation breath now. Okay, so this is another 30 seconds after the wrapped here. Okay, then after that you start our ventilation breath. So we are now at 1 minute. Okay, so this is now 1 minute. So start ventilation breath, then 1 breath every 2 seconds. So this is room air. So if available, you can also adapt a supplemental oxygen according to the knowledge saturation levels. So that's one when you can use. So we are talking about this. Okay, so depending on that, so you start your ventilation breath, 1 breath every 2 seconds room air. Okay, then after that, you again reassess the child, you assess the color, tone, breathing, and heart rate. Okay, if the baby has improved, or if the baby is improving, then you can also just go and monitor the oxygen response and refer for management or update. Also update patients, update parents, or debrief them about the condition and how the baby is faring. Okay, so it's important to update parents, because you don't want just the baby was born, maybe they were there, the mother even you even showed them the sex and everything, then the next thing you want to just tell them that the baby has collapsed. No, at least you have to be informing them. So okay, now we're trying to resuscitate. We are doing by all means. We're trying to resuscitate your child. Okay, if we don't want maybe to tell directly the mother, if the father is around, then you talk to him at least so that one parent is informed. Okay, then as you are resuscitating, then if the heart rate is more than 60, then you can continue with the ventilation breath per minute. There's no need of going to the next step, which are the chest compressions. Okay, so if the heart rate is more than 60, just continue with the ventilation breath. So one breath every 2 seconds. Then again you come back after they finish the cycle. Then you reassess again the tone. If the baby is improving, then you go to this side. If the baby is still not improving, or if the heart rate drops to less than 60, then that's when you start chest compressions. So chest compressions you do 3 compressions and 1 ventilation. So you do for 30 seconds, supplemental O2 if available. Then IV access. Then also check for blood sugar and give 10% dextrose, about 3 to 5 mils per kg. Okay, that's the chest compressions. Then on the chest compressions, so after you do your chest compressions, then okay, I think I've skipped some steps. Okay, so after the chest compressions, you go back to reassessing the child. This is another 30 seconds that has elapsed. So you go back to reassessing the child, which reassess the color, tone, breathing, heart rate. So if the baby is improving, then you start just monitoring oxygen response, monitor airway or breathing, and if there is any need for you can also refer for management and also update parents and debrief them. Okay, so that's how you do it. Then again, despite these measures that we have taken in place, if the heart rate again still drops to less than 60 again, so this is where we are now. If the heart rate again drops to less than 60, then we still continue with compressions and ventilation. So we do 3:1 ratio, supplemental O2 if available. Then you can also give adrenaline about 0.1 to 0.2 milligrams per kg. So you can either give 0.1 or 0.2, or if you want, you can just go to the upper limit, which is 0.2. Just give the upper limit so that don't get confused a lot. You can just give 0.2 milligrams per kg, 0.2 mils per kg in 1 in 10,000 concentration. Okay, then after you give, again you reassess the child, you assess for the color, tone, breathing, and heart rate. Okay, if the child is maybe improving, then we go back to here. If the baby is improving, then still go back to monitoring oxygen response. If there is any need for referral, we refer. That's the same thing we are going to do. Okay, but again, despite these measures, then again the respiration, the heart rate is still less than 60. You still continue your compression and ventilation. So you still continue the compression and ventilation. You do your 3:1 ratio of supplemental O2 if available. You give adrenaline. Now here, initially we said you start with a 0.1 to 0.2, but this one is just fixed. You just do a 0.3 milligrams. At least you increase the dosage, because now I want to again increase the dosage to see if there will be any response. So here on this part, if you just bear in mind what you had started with. Okay, so if you started with 1, then you still go for 0.3, but if you started maybe with 0.2, then you have to also just follow your initial one you started with. Okay, since here we had started with 0.1, that's why here we have gone for 0.2 mils per kg in the same 1 to 10,000 concentration after 3 to 5 minutes. So be given every after 3 to 5 minutes if the heart rate is less than 60. Then also correct any hypovolemia if necessary. You can give a 10 ml per kg normal saline IV if necessary. Okay, then then after you have done all this, then you go. This has also taken another second, then another 30 seconds. Then you reassess the child. You sit for the color, tone, breathing, and heart rate. Then after that, then if the baby has improved, meaning you go back to where the baby had improved. So if the baby has improved, then you do this. You do monitor your oxygen response, monitor the airway. If there's any need for referring, you refer. Okay, that's how you do it. Okay, but again, if at all again there is after reassessing, after doing what we have done, then there is no sign of life in neonatal, the resuscitation can be called off after 20 minutes. There's no need of someone continuing resuscitation. We ask them how long have you been resuscitating. They are like 25 minutes has elapsed. Then they want you now to maybe use a technique that they haven't used. No, like the time has already elapsed. So if you do another technique, then the child comes back, the child will be handicapped, they may have serious neurological complications. Okay, so remember we were updating parents on each at least on crucial steps. So even after there's no life in the newborn, at least the parents were getting some information on how the resuscitation was going. Say, okay, at this stage we are now just trying to do this and this. Okay, at this stage maybe the heart rate is there, but it's only because of the adrenaline that we have given. So if the adrenaline was to stop circulating, most likely the child maybe might not survive. Okay, it might not survive. So we are just preparing them psychologically, so that by the time we want to give them the bad news, at least they are now prepared psychologically on what we're about to say. Okay, and if they're hoping for a miracle, miracles do happen as well in medicine. Okay, so basically that's it in neonatal resuscitation algorithm for Zambia. So you have to know that you have to maintain a normal temperature throughout, and at all times ask if you need any help. Okay, that's the thing that we wanted to share on the algorithm. And if you have any questions, if you have any clarifications, anything that you need, you can just type in the comment section. And you can also check out the tutorial video, another tutorial video on neonatal resuscitation, more of an walkthrough, and also for do's and don'ts when you are doing neonatal resuscitation, where we demonstrate and not alone just demonstrate, where we also give out common mistakes and other do's and don'ts that you see in neonatal resuscitation. Okay, otherwise, thank you for watching. If you haven't subscribed, please subscribe and hit the bell notification. And see you on the next video, and give us a like and share this video to people who might benefit from the algorithm. Okay.